Erectile dysfunction is often a very treatable condition. Sometimes it cannot be cured, but generally there are many treatments available. We always start by looking at lifestyle changes that may make a difference, such as losing weight, increasing exercise, and perhaps adjusting some medications. Issues like smoking and diet are very important when dealing with this problem. As a man ages, lifestyle changes tend to be less efficient in making changes. We then look at medications and various devices that are used to improve the quality of the erection. A common treatment for erectile dysfunction these days is oral medication known as PDE5 inhibitors. The other treatments we use are penile injection therapy, the use of a vacuum erection device, and occasionally the insertion of a penile implant. The psychological causes of erectile dysfunction include conditions like depression, acute or chronic anxiety and stress, and relationship difficulties. It is always important to look at the relationship a man complaining of erectile dysfunction is in and whether his partner is able to be involved in the treatment process. Sometimes by treating the depression, the erection problem may improve. Often the partner is vital to helping the man make changes to improve the situation. Sometimes relationship counselling is required to sort out any areas of conflict with the man and his partner. Oral medications are a very effective form of treatment for erectile dysfunction. They are obtained only by prescription from your local doctor or a specialist. Generally, these medications are taken 1 to 2 hours before planned sexual intercourse, and sexual stimulation is required for the tablets to be effective. There are some side effects that are usually not troublesome. These may include flushing of the face, blocked nose, a headache, and even occasionally some gastric reflux. There is a high satisfaction rate from use of oral medications. Mostly men are satisfied with the result and take these medications on a regular basis. Sometimes oral medication is all that is needed for an effective treatment for erectile dysfunction to occur. Penile injection therapy remains a very effective treatment for erectile dysfunction, particularly for the more difficult cases that may not respond to other methods. Some years ago, when oral medications were not available, penile injections were much more commonly used. We still use these occasionally, as I said, for the more difficult cases, as generally the response and result is much more predictable and usually very effective. There are side effects that need attention. These can be a prolonged erection called priapism. Occasionally there can be scarring in the penis from repeated use of the injection, and occasionally there may be a slight amount of pain from the chemical that is injected. For men that don't want to use oral medication or penile injections, there is a device called the vacuum erection device. This is a simple plastic tube placed over the non-erect penis. Air is extracted via a pump mechanism, and the resulting vacuum creates an enlargement of the penis. Some men see this as a little cumbersome, but generally the older couples find it quite effective, though it does take some practice over time for it to be working well. An erection obtained from a vacuum device can be a little different to an erection obtained from oral medication or penile injections. The erection may be a little dusky in colour and may be a little cooler, though many of the older couples who use this device are very happy with its effectiveness. For men who have tried all treatments and there's been little success, the final option is the insertion of a penile implant. This is a device that is inserted into the penis. A pump is located within the scrotum, and a reservoir of sterile saline is located just inside the abdomen above the pubic bone. When the man wants to engage in sexual intercourse, the penile implant is activated by squeezing the pump in the scrotum. Fluid is thus transferred from the reservoir into the penile tubes, thus an erection is created. Following the cessation of intercourse, the pump is squeezed in another fashion to deflate the device. This method is very effective, but is generally only used when all other methods have failed or are ineffective. Men who have a penile implant inserted must be counselled, particularly with their partners together. Those who fit the criteria for such treatment are generally very satisfied. There are some issues regarding risk of infection and mechanical failure. But overall, these do not seem to be a problem with the modern and highly engineered devices available today.